So just some tips for telling apart the different vertebrae. I think when they're all together in one long vertebrae, you can just count down them, and it's really easy to tell. Like the first seven are cervical, then 12 are thoracic, and then five are lumbar. But when they're not put together and they're just in individual pieces, it's a little bit harder to tell. So one thing that I noticed is starting at the top, the cervical vertebrae have an extra foramen, which a blood vessel passes through, but that stops at the seventh cervical vertebrae. So that's just a cervical thing. So if you can see or feel an extra hole, not the big one that's for the spinal cord, but two little ones on either side of that, which are called transverse foramen, which makes sense because they're next to the transverse processes. If you can feel or see that, then that means it's cervical. And then moving down, the next 12 are thoracic, and they actually articulate with ribs. And so they have a little place for the ribs to hook in and articulate. And then after that is the lumbar, and the lumbar do not connect to any ribs, so they're not going to have that same smooth surface. And they're a lot bigger. It's pretty easy to tell them because they're so bulky. But for the thoracic and the cervical, there's those couple little tricks to tell the difference between them if they're not all lined up together.